If you consume any modern media, the messaging is relentless. Movies, jokes, and the adult entertainment industry all broadcast the exact same idea. When it comes to male anatomy, extreme size is the ultimate metric of success. This constant saturation creates a heavy psychological toll. It breeds massive insecurity in men who measure themselves against impossible standards and sets false, unrealistic expectations for women. But we need to see what happens when we turn off the screens, strip away the media conditioning, and look exclusively at biological science and anatomical data. Curious. The question we have to ask is whether the human body actually cares about these extreme measurements, or if we have been sold a biological lie. Understanding the true science of our anatomy is the only way to separate manufactured anxiety from human reality. In an unaroused state, female anatomy measures 3 to 3.5 inches deep. During arousal, tissue expands, increasing capacity to 5 to 6 inches. The average male anatomy, 5.1 to 5.3 inches, perfectly aligns within this expanded zone. The two mechanically fit by design. But internal capacity is only part of the equation. To understand pleasure, we have to look at what scientists call the 85% rule. Roughly 85% of women require clitoral stimulation to actually reach orgasm. This means penetration depth is not the primary driver of physical satisfaction for the vast majority. There is a statistical minority. About 20% of women do say they prefer larger sizes, often because they specifically enjoy deeper cervical or G-spot stimulation. Yet from a purely biomechanical engineering standpoint, extreme internal length is irrelevant for most people. Our bodies naturally evolved to accommodate the statistical average. We can also test this by looking away from biological hardware and examining consumer behavior. What choices do women make when they are purchasing purely for their own pleasure? This chart displays empirical market data for sex toy sales. It shows a massive peak squarely in the 4 to 6 inch average range, with sales dropping off rapidly as the sizes become extreme. This creates a direct contradiction. If size truly mattered as much as society claims, the capitalist market would reflect massive demand for extreme sizes. Instead, the exact opposite is true. So why does the myth persist? It comes down to a major psychological flaw. Human beings are notoriously terrible at judging physical measurements. Multiple psychological studies show that both men and women consistently overestimate measurements. We routinely assume that average is much larger than it actually is. Our perception of size is an illusion. Warped by external pressures, we buy into a myth that neither our biology nor our choices support. The obsession with extreme size is a phantom problem. It is manufactured almost entirely by the media and the adult entertainment industry, not by biological reality. This pie chart maps the bottom line survey data on female satisfaction. It clearly illustrates that an overwhelming 85% of women are fully satisfied with their partner's current size. With the insecurity put to rest, we can redefine the parameters of sexual success by shifting our focus completely away from biological hardware. What actually drives a positive sexual experience is intimacy software, the dynamic, behavioral factors that happen between two people. This software relies on active communication, playfulness, emotional connection, and understanding a partner's unique anatomy. Worrying about an uncontrollable genetic measurement is an exercise in futility. Developing dynamic, learnable skills, on the other hand, puts the control entirely in your hands. Great intimacy is a cultivated skill built on connection and communication. The science is clear. Behavioral skill dictates